if I can detect the cancer at an early stage, then the outcome is always good. We will provide a complete algorithm how to deal with the situation.
How often should individuals undergo these screenings?
Right, so it depends on the family history. In case of breast cancer, but we suggest at the age of 25, one girl should check what is the risk of developing breast cancer, right? And it should start at 25 only. So once we categorize the girl as a low risk or high risk or intermediate risk, if it is a high risk one should start the screening at the age of 25. What we mean by high risk? Suppose a girl is having a positive family history. She is positive for a gene called BRCA, BRCA1 or BRCA2. We all are aware of the famous story of Angelina Jolie, where she underwent a prophylactic mastectomy and a oophorectomy. She removed her breasts as well as the ovaries because she was a carrier of BRCA gene, right? So those who are a BRCA carriers, they have a huge chance of developing breast cancer and ovarian cancer. So these are the patients where we should start the screening at a very early stage, starting at the age of 25, right? Otherwise, in a normal risk individual or low risk individual, it is recommended that we start doing a mammography at the age of 40 to 45, right? So that's the age where there are different societies. The recommendation varies among the societies, but by and large, one should start the screening in normal risk or low risk individual at the age of 40 and 45, then yearly it is to be continued up to the age of 54. And after that, by and large, that means once in 2 years, one should do a mammography to pick up the breast cancer at an early stage. Regarding the prostate cancer and other cancers, it is usually the older people who develop these cancers. So we recommend after 45 or 50, one should go over these screenings. Like colon cancer, we recommend if the patient is having any bowel change, any bleeding per rectum after 40, any sudden change in the bowel habit after 40. So one should go for a colonoscopy annually after the age of 40. So by and large, 40 is the age after which one should go for these screening modalities.
Okay. Next question is, are there any new advancements on technologies in cancer screening that people should be aware of?
Yeah, so previously we used to do something called conventional mammography. Now it has moved to digital mammography and tomography. So these are the advancements which are there in breast cancer diagnosis. Not only that, there are several other tests because these tests will ultimately pick up a cancer at an early stage. We are now doing gene tests. As I told you, like the BRCA gene, which we can detect it from the oral cavity tissue or from blood also, right? So if I do a test and the patient comes positive, then the screening should start at an early stage. There are some tests which will detect a small DNA being circulated in the blood, by which we can detect cancer at an early stage. Although these are experimentally being done, they are yet to come in the guidelines in next 5 and 10 years.
What are the most common signs and symptoms that might indicate the need for cancer screening?
So the dictum is, if I can detect the cancer at an early stage, then the outcome is always good. So by doing screening tests, we are detecting that the cancer at a very early stage. That means the patient is yet to become symptomatic, right? But if we detect the cancer at an early stage when the patient has just become symptomatic, so the symptoms, they have started to arise. At this stage also, the patient is curable, right? So we need to be aware of all the symptoms which can be due to a cancer, right? So for breast cancer, if we get a lump in the breast which is painless, remember the cancerous lumps are, to start with, they are not painful, they are painless. So a patient with a breast lump which is painless is growing gradually. This is an indication that you should go for a screening test or you should go for a diagnostic test. you need to confirm that lump whether it is malignant or a benign one, right? But remember, a breast lump out of 10, only 1 will be cancerous. 9 will be non-cancerous. But we need to check all 10 to detect one cancer, right? So from head to foot, if I discuss the symptoms, any symptom which is occurring in my body, which is persisting for more than 6 weeks, study from oral cavity, say for example, one small ulcer. We all get oral ulcers by a tongue bite or a deep bite, right? But it usually heals within 4 to 6 weeks. But if I get a tongue ulcer or an oral ulcer which is persisting for more than 6 weeks, it's time one should consult a doctor. Coming back to the lower region, that is the neck. If I have a neck lump and the lump is persisting for more than 6 weeks, it's a time to consult a doctor. It can be a simple lymph node. It can be a benign thyroid lesion also, but we need to check it whether it is due to malignancy or not. If we go a little below, then the chest, right? So in chest, the lung is the organ which is there. So lung cancers, they can present as chronic coughs or hemoptysis. Hemoptysis means presence of blood in the cough, right? So one person who is having a cough which is persisting for more than 6 weeks or having a discharge for a cough containing blood, this is the time where we should consult a doctor. Going further below, abdominal symptoms, gas and etc. is a common symptom among all the bionics, right? But we many a times ignore these symptoms as gas. We don't need to know anything, go for some over the counter antacids and etc. This is a wrong practice. So when I have an abdominal rotting, pain in the abdomen, jaundice, or having a blood in the stool, change in my bowel habit, that is very important. So sudden change in the bowel habit. If all these occur, increase in the cut of the abdomen. In ovarian cancer, the commonest presentation is loss of weight and there is an increase in the belly, right? So these are symptoms which we should not ignore. And one should consult a doctor if these symptoms are persisting. Apart from this, any swelling in the body which is persisting for more than 6 weeks, any mole in the body which is persisting for more than 6 weeks, having a recent increase in the size or having a bloody discharge from the mole, it's a time you should consult the doctor, because all this can be a symptom of cancer, but this may not be a symptom of cancer also. So you need to check it whether you are suffering from cancer or not, right?
How do individuals access their risk factors for different types of cancer?
Right, so there are some online tools also. In our hospital, we do have certain preventive, we call it preventive oncology clinic. In this clinic, we see patients who are not having cancer, right? So those who are not having cancer, in this clinic, they are being consulted, and we have a fixed pro forma by which we measure the risk of that particular individual. If the patient belongs to or the person belongs to high risk category, then we suggest certain tests, right? So there are free online tools which are also available there. We do have advanced tool to identify whether this lady or boy is having a higher chance of developing cancer or not. If necessary, we can go for certain genetic tests based on the symptomatology, based on the family history.
What advice do you have for people who might feel anxious or fearful about getting screened?
Right, so see, this major anxiety about screening is I might be detected with cancer. But see the other side of it. If you have a cancer and that is detected by a screening test, that means your cancer is absolutely in early stage. That means doing a screening is of immense benefit. It will detect the cancer at a very early stage, right? And we all know cancer is curable if detected early. So a screen detected cancer is almost always curable. So don't be afraid of going for screening, because if we do screening, even if you detect the cancer, it will be 100% curable most of the cases, right? So there is nothing to be worried about screening, and one should avail all sorts of screenings wherever applicable.
As can lifestyle changes impact the effectiveness of cancer screening?
Yeah, so lifestyle changes obviously because cancer is a lifestyle. So the smoking habit, food habit, alcoholism, etc., sedentary lifestyle, not doing exercise daily, all these are indirectly or directly will cause cancer, right? So if I change my lifestyle to a better lifestyle, I have a immense chance of not getting cancer, or even if I detect it with a cancer, it can be treated properly, right? One study was published. It was shown that if I do an exercise of 10 to 15 minutes per day, which is nothing, 10 to 15 minutes we can fight for ourselves. That's not a big deal. So doing an exercise 10 to 15 minutes per day, and by meaning exercise, I don't mean doing a fancy exercise in the gym. It can be running, it can be walking, it can be cycling, it can play football, it can be dancing, anything which gives me a sweat, right? So 10 to 15 minutes of vigorous exercise will prevent you not only from cancer, but also from cardiac and diabetes problems and from several other metabolic problems, right? So doing regular exercise, maintaining a good lifestyle is always beneficial.
What resources and support does NCRI Hospital Kolkata offer to patients undergoing cancer screenings?
Right, so this NCRI hospital is a comprehensive cancer hospital. Well, the new facility which we have started is something called preventive oncology clinic. Here we have experienced doctors who are there, who are taking care of normal individuals who are not having cancer, and they are having a high chance of developing cancer. Many patients, many relatives of the cancer patients, they come to us. They say, "Doc, what is my chance of developing cancer?" So here we are assessing those patients. We are categorizing their risk. What is the risk of developing cancer in that particular individual? And remember, screening test is not universal. It can vary from age to age. It can vary from different patients to different patients, right? So here we prescribe the appropriate screening test for that individual in the preventive oncology clinic. So that's a new advancement which we can offer, we regularly offer in NCRI Hospital.
How can people learn more about the screening services available at NCRI Hospital?
Right, so these screening services, we do have all sorts of screening available, starting from breast cancer to prostate cancer to colorectal cancers and cervical cancer. These are the main cancers where screening tests are available. We do have the facility of doing this. Those who are afraid of going to a cancer hospital, this hospital has separately created a wing called preventive oncology wing, where we see only normal patients, not the cancer patients. So this is the clinic where normal patients can freely come and they can assess the risk of developing, what is the risk of developing cancer in that particular individual. So coming there doesn't mean you have to do all the tests, right? They can come and they can tell their family history, they can tell their symptoms. We will provide a complete algorithm how to deal with the situation, what next he has to do. It might be so that we don't prescribe tests to everyone. It might be so that a minor lifestyle changes can solve the problem. So these are issues we are dealing efficiently in the preventive oncology.
Either way, thank you so much, sir.